Dr. Kim Williams, this next speaker you all see is a past president. He's got this big pedigree. He's a past president of the American College of Cardiology and the American Society of Nuclear Cardiology. Now, he's the former chairman of the board of directors of the Association of Black Cardiologists. Dr. Williams is an expert in health equity and the founder of the Urban Cardiology Initiative in Detroit, which is a program that works to reduce ethnic heart care disparities. Now, I've heard him speak. When Dr. Williams speaks on equity and healthcare, he becomes even more passionate in his delivery. And you can really see that he really cares about the individual and really wants to affect change in the community. So he is the current chair of the Department of Internal Medicine at the University of Louisville. He's nationally renowned cardiologist who has long advocated for disease prevention through nutrition. Now, I heard a story of how the poor care he received as a young 11-year-old helped inspire his medical career, and the data he shares on nutrition's impact on disease prevention and longevity may have you rethinking your own diet. Now, right now, there really is a cataclysmic amount of cardiovascular disease in the United States and around the world. And I know that there are people on here in Africa as well as the United States. So the information that Dr. Williams will present today is so timely. Dr. Williams is an educator and a student of learning. And as a matter of fact, just like he said recently, he is currently attending the Cardiovascular Research Technologies Forum in DC, where Hillary Clinton is the keynote speaker. But he's taken time out of his conference to present here at our conference. So we're really honored. And now it is my pleasure to welcome Dr. Kim Williams.
Well, thank you so much. Before I start by sharing my slides, can I find how many countries are represented here? Which countries in Africa?
Ooh, we've got Ghana, we've got Kenya, we got Zambia.
Wow.
We've got Zimbabwe, South Africa, Kenya. It's all over, many countries.
Fantastic. So it's really important to recognize that I'll be talking about a fair amount of international stuff. A lot of what I'm presenting is about the United States, though, and what we back in the 60s we called the African diaspora, and I think that still is a proper term. So let me share my slides. There we go. And I really appreciate the opportunity to speak and to, as I was speaking with Dr. Montgomery, we will spend a lot of time talking about the issues of lifestyle and nutrition. And I was asked to speak specifically on reversing heart disease, preventing and reversing heart disease. And hopefully you can see my slides pretty good. And we'll go on there. Okay. All right. So as you've heard already, this is the most important thing that we can talk about. Yes, high blood pressure is it might actually catch up with it, but high blood pressure is really an issue of diet in most cases, the vast majority of cases. And so dietary risk really is the number one cause of poor health in the United States and around the world. And these are opportunities to try to prevent chronic heart disease, because we know the relationship between heart disease, and I'm going to spend the next hour really describing for you. Now, I know that this organization is dedicated to rolling back diabetes, so it's worth talking about diabetes. Why? Because it's so prevalent, particularly in the United States, where the obesity situation has us really rolling in difficulty with refined grains and sugar-sweetened beverages and the like, all of which with the increase in insulin that happens in your bloodstream. Insulin is amazing at keeping diabetics out of trouble, but it's also an amazing growth hormone. And the more growth that you get, the more insulin resistant you get, which means that you need even more insulin. And guess what? The heart's arteries, every time the insulin level goes up, a little bit more plaque goes in. And so what's going to happen when we have teenagers who are so overweight? And if in the United States, this is really around the world, but if you look at that bottom line, spending $160 billion on diabetes alone. As a kid growing up on the south side of Chicago, I was mentioned things. A lot of perspectives and political thoughts. And yeah, I'm going to try to rearrange my schedule so I can see Hillary Clinton. But the someone who really thought deeply about these issues as a leader. Well, but we're really suffering right now. But point out two things: not just the 160 billion on diabetes, but almost if it's 18, that's almost 1/5 of our gross domestic product, that is the things that we are making in the United States, is spent on healthcare. And then that second bullet, 80% of the healthcare dollars that we're spending are on preventable chronic disease. If people would just live right, that is, fix the diet and actually do some exercise. So more of an international perspective before I focus, more on the United States and issues that we have in the African-American community. Look at that. And part of this difference in how much we spend per person versus the other developed countries, what is that about? Well, it has to do a lot of the insurance industry and the malpractice lawsuits. And, you would think that when you sue a doctor or a hospital, they're really hurting, but all this does is raise their insurance rates, and that gets passed on to the patients. And so the total cost of healthcare, with exorbitant cost of drugs, exorbitant cost of devices, everything that's in our healthcare industry, the entire enterprise, works towards making it the best system with one of the worst outcomes. And, if somebody in Belgium or Finland gets really sick, they kind of want to come to the United States because we have the best technology, but our own people are not availing themselves of that technology and ending up living longer. And that's really on us. We have to do a better job of education and putting on international symposia like you guys are doing. So thank you for doing this. In the US, and this has been reflected around the world, but it's not quite as striking. This is the heart disease death rate over a 40-year period. And it was really going down. And I took over as the American College of Cardiology president in 2015. I was looking at all this data, and I got up there in front of 5,000 people and said, I'm not going to retire until heart disease is number 2. I thought it'd be a couple of years. It turns out it started reversing, it started going in the opposite direction. And why? Because of things: heart failure, high blood pressure, ischemic heart disease. If you're not familiar with that, that is heart attacks. The fact of the matter is, it started going the opposite direction because of the things that we are eating and our lifestyles. And all the technology in the world can't keep up with it, because all the technology is mopping up the floor instead of turning off the faucet. When are we going to go back and change what's creating the disease instead of coming up with more and more creative ways of managing it? Nothing against developing ways of helping people, new devices. The CRT meeting is all about the newest and latest and greatest. And I was just talking about hypertension, talking about nutrition, of course, and they were talking about renal nerve denervation catheters. You put in there and you put in a signal, and the nerves to your kidneys just stop sending a signal to put out the hormone to raise the blood pressure. And you know what? Why not get rid of the blood pressure the right way in the first place? Why would you need a super duper catheter? So we have some great mops, but is that really what we want to do? Because at some point, the disease will overtake the technology, and that's what's happening now. So we are stuck with this burden of disease around the world. And I'm talking about the United States, particularly because that bottom line, the African-American, the African diaspora, some form of cardiovascular disease, and over 50%, a 21% higher mortality rate. But the other one, from the international perspective, is that heart disease is not the #1 killer in the majority of those countries that I was showing you on the previous slide. It's fallen to second place. It's only in low and middle income countries, and the only high income country in the entire world that has heart disease as the leading killer is the United States of America. And so we're doing it wrong, and hopefully we can learn from everyone else. Throw into the mix the vast pandemic of COVID-19 on top of the slow heart disease pandemic that had been going on, #1 cause of death. in the United States since 1918, when it was taken out for a year by the Spanish flu, but it didn't last. By 1919, it was back again. And COVID, we thought it was going to take out heart disease. It actually, as the number one killer, if you had taken all of the heart-related COVID complications out, and it had started in January instead of really getting going in March, it would have taken it out. But bottom line, it didn't. Heart disease is still the number one killer of Americans. And that's because, but COVID just jumped on top of that, because all of the risk factors that make heart disease, diabetes, as we've been talking about, obesity, hypertension, these are issues that COVID-19 took advantage of. And if you're obese, and you've got a lot of fat cells, your COVID-19 virus, the SARS-CoV-2 virus, is going to reproduce faster in a fat cell than it will anywhere else. And the diabetics have an impaired immune system. The hypertensives have impaired blood vessels. And so a disease that attacks blood vessels and inflames them makes a poor outcome. So this was really what we didn't want to see. One of the things that we saw with COVID, and we see it all over, is worse outcomes in people of color. And that really has a lot to do with socioeconomics. When it happened, it's the social determinants of health. People talk about food insecurity. I'm going to give you my own take on that in a bit, but having poverty, having poor access to care, accessing care poorly, having access to poor care, 3 different access issues, and having, poor housing, not being able to isolate during a pandemic. And these are all issues that make the dual pandemic even worse. A lot was made about Black people dying early on. Notice this is New England Journal of Medicine 3 months into the pandemic. And I was at Rush University at the time. We actually had very similar data. They published it first, so we didn't bother. But the fact of the matter is, there were a lot more deaths in Black people here. That was New Orleans, that Ebony Price Haywood was presenting. And it was more in the United States as well at Rush. And the issue was, very simply, that we had more risk factors in our Black population. That's really what the issue was. And if we were to tamp down on the risk factors, we would not have such a major burden. And so you could actually statistically adjust for amount of obesity and amount of poverty. And you do that, Black race was not associated with more death. In fact, it was a hair protective for reasons that we may not know. Well, one of the things that it was very startling when it came out a few months ago was the fact that you could take existing trends in disease entities that end up in heart disease and end up in heart attacks, and sort of project, if things stay the same as they are, nothing changes, where are we going to be in 2060? And the answer was not good. Now, this is a complicated diagram with all the data if you want to do a screen capture and study it later, but I'm just going to break it down for you. Number one, all of the risk factors, including diabetes, the largest increase is diabetes. So anyone who's talking about rolling back diabetes, you're right on. We need to change this, okay? But high blood pressure, high cholesterol, overweight, obesity, they're all supposed to increase. And what would happen? You can model it out. If you have more diabetes, more high blood pressure and the like, you're going to get more heart attacks, okay? That's ischemic heart disease and myocardial infarction. Those are terms for coronary artery disease. Heart failure, where the function of the heart is poor either with the squeezing or the relaxing. And of course, stroke. And, stroke, I have so many patients who say, Doc, I'd rather die than have a stroke because it's disabling. It's a tax on your family, a huge tax, where they're, wheeling you around and taking care of you instead of living their lives and, having, and taking care of their own families. Or the little kids, I mean. And so the more startling part about these projections was that all of these diseases and risk factors are projected to decrease in whites but increase in racial minorities. And our Black population isn't growing that fast, but the Hispanic population is growing. And this is exactly what we're going to see. More diabetes, but a lot more high blood pressure, higher cholesterol, more obesity, and then all of the consequences in terms of cardiovascular disease will go up, no question about it. It's not too late. We need to act now. We need to put on more conferences, more realization that every time you say, you save a cow, you save a kidney. And I'll talk about that in a little bit. But it's an opportunity to improve our outcomes just by improving our diet. But that's not what's happening. We could put all the guidelines in the world, but if we're marketing bad food, people are going to eat bad food. And the idea of eating 2 or 3 cups of vegetables per day, 90% of Americans don't do that. And here's what we result in. You have much less of this in Africa historically, but we have a lot of places where there are a lot of overweight and obese people. And so if you look at this obesity, more than 35% of the people in a state, it's a handful of states, including where I live now in Kentucky, but that's everyone together. Suppose you just do the white population in the United States. It's just a handful of states. If you do the Hispanics, it's a lot more. But if you do the Black population, it's almost every state. And so what is it that we have to do? We have to go in, try to figure out how to affect cultural change. Implementation of change is not, behavioral change is not easy. We have to be respectful of where people came from and make sure they understand where they're going. That's our task. We can't do it like this. Did you know that not just the United States, but in many countries, the poor communities have more fast food restaurants? Why is that? Well, the tendency is to have, poverty goes with level of education, and people who are less inclined to understand the health consequences eat what tastes good. And if this didn't taste good, they wouldn't be able to sell it. And so this is a major issue all over the world, not just the United States. But in the United States, we've actually looked very carefully at breakdown, particularly in the southern portion. This is from University of Alabama in the Deep South, where they looked at all the dietary patterns and what they did to people. And it turns out that if you look at one of these Kaplan-Meier plots, you'll see a few of these today. It's just real simple. You start at time 0, everybody's alive. And then you go a month or 2 and people start having events. And then you get more and more and more until you get to 5 years. And anyone who was on a Southern diet was putting themselves at risk. What's a Southern diet? Well, it's the kind of food we ate on the south side of Chicago. They were talking about Alabama, but it was true all over the South, and wherever there were people who came from the South, particularly African Americans, where you're eating a lot of fried food, a lot of organ meats, entrails, taking ham and neck bones and putting it in the greens. The greens would have been healthy without it. Yams are great. Candy yams, not so great. Tea is great. Sweet tea, no. And so we end up with a pattern of high saturated fat, high sodium, and high refined grains, including sugar, that result in the diseases that we could so easily avoid: heart disease, kidney disease, and stroke as well. And so what is it that we can do? What I would propose is that we do everything we can, and I've gotten some traction, not just me, but there are about 200 of us that were giving recommendations to the White House for the September conference on food and nutrition. First time they had one of those in the United States for 50 years. Richard Nixon did one, and no one had bothered since then until Joe Biden. So what we have to recognize is that we have to get people to understand community education, and we have to make a difference with our marketing, and we should be labeling food. And if we do everything we can to get everyone on a whole food plant-based diet, which is scientifically proven, as I'm going to show you, to improve all of this stuff, reverse conditions, improve outcomes, and drop our healthcare costs. Why not? Okay. So I don't know how many of you have seen this slide before, but I just have a slightly different take on it. It's showing you that you got three people trying to watch a baseball game. The short person is, obviously can't see around the fence, and that's equality. Giving them all a boost, the same boost doesn't help. Okay, so how about equity? That's where you do the right thing, which is to give the person what they need in order to see over the fence. Okay, that's really good. But then there's reality. And this isn't true in every country, but there's a lot of this going on in the United States. Those who have get more, and those who don't, you just dig a hole. What I'd like to say is that we could do better, particularly when it comes to healthcare, particularly cardiovascular health, and that is food justice, okay? And that is, we should be able to just remove the fence. If we did that, we wouldn't have any problem seeing the game at all. Why not? And so the removing the fence, and people say, oh, that's not, it's been the number one killer for so long, you can't remove it. I'm here to tell you that it can. And the black-white disparities that we've had in cardiovascular disease, we had them for smallpox. We had them for with polio. We had them when the French quit digging the Panama Canal because too many blacks were coming in and dying, and they just couldn't ethically do it anymore, okay? And then Walter Reed folks figured out it was the mosquitoes, and blacks stopped dying in Panama, and the United States got it done. What happened in each of those three cases is they came up with a way, vaccines, mosquito abatement, to get rid of the fence. So that's what I'm asking everybody to do, is just remove the things that the precipitators of heart disease. If we do that, then everybody will have an equal chance to avoiding it. Okay, so I have to start with the marketing issue. This is a publication that you could Google if you want to read the entire article. I'll summarize it for you. Michelle Ikram was one of my residents. She's now a cardiology fellow in Chicago. Kari Hill is my granddaughter. And she was hanging out at my place for a summer, and I've seen she's watching a massive amount of television. I say, Kari, why don't you just write down what you see every time there's a food commercial? And she did. And there had actually already been published in the Journal of American College of Cardiology a food scoring system. It was directed toward healthy and unhealthy plant-based diets, but unhealthy, considered all animal products, right, justifiably so, all animal products as unhealthy. And then refined grains, things with high sodium, sugar sweetened beverages, saturated fat, those would all be considered unhealthy. And so Kari actually, and Michelle probably did 20% of the commercial watching, but between the two of them, they did the scoring, and this is what it looked like. 104 commercials, okay? The number of unhealthy items scoring -1 outweighed the number of healthy items that people were seeing. So 50% of the 58% were actually fast food chains, and they averaged a score of -3. That is, when you have a cheeseburger and you've got lettuce and tomato on it, that's a +1 for one serving of vegetables, really. But you've got a refined grain bun, you've got French fries, and you've got a soda pop with it. You end up very negative, and this is what people are seeing. And so when they were showing brands or grocery stores or home delivery meals, they were a little healthier, but they were still negative because there's animal products. And so each of those wasn't quite as bad as the fast food chains, but they were still not what you'd want. So we recommended that they just do what they did in the United States in the early 70s for cigarettes, which is, and in Canada and European Union, don't advertise bad things to children. In the 1970s, United States, we got rid of cigarette commercials, okay? So it's been done before, but these are very large lobbies. I'm not sure this is gonna happen. Of all the recommendations that I made to the White House, they actually took all of them except this one. And I know this was just a big ask, but somebody had to say it. Why? Because it's not an equal situation. This is a good example of digging a hole for the underserved. That is, who is watching those television commercials? It turns out it's poor people. And so this is University of Chicago's data showing that the odds of you watching a lot of television when you make, $150,000 is almost zero. But people making less than $10,000 a year, it's a good percentage of them are watching massive amounts of television, and they're being pre-programmed. Their taste buds are being set by what they see. Don't tell me that marketing doesn't work. It does. They wouldn't do it if it didn't. They wouldn't spend all the money if it didn't work. Okay. One of the next things I'd like to talk about is people talking about our south side of Chicago, west end of Louisville, saying that they're food deserts because there's not a lot of healthy food not sold in local stores. I have a completely different take on it. Number one, yeah, you can call it a food apartheid. That is true in Louisville. I live on the east side where, there's more education and stuff like that, and you get anything you want at the grocery store. No question about that. When I do my clinics on the west end and I stop in a store there, it's exactly what people are calling food deserts. Well, I don't think people should call it swamps because swamps are actually good, but this is the problem. I just put an extra S in food desert, change it to a food dessert, because it's us. We're asking the grocery stores are not in the healthcare business. They're in the business of giving you food that you will eat or buy, or else they're going to go out of business. So we are the problem, not them. So we need to train ourselves. We need to have enough health education and nutrition savvy to go and ask the grocery store to carry less animal products and more whole food plant-based. Go to the produce aisle in the grocery store, and when you're done in the produce aisle, go to the cash register. If everybody does that, they will get the message and they will carry healthy stuff because that's what's selling. Okay. Next issue is the fact that the United States has been spending billions of dollars every year subsidizing the kind of foods that actually increase obesity and increase the healthcare budget tremendously. That's something that really needs to stop. High fructose corn syrup, hate to call out any one particular product because there's plenty of them out there. It's just that the Hostess Twinkie has 14 of these ingredients that are subsidized and do not contribute to human health, and quite the opposite. So I'm going to spend the next few minutes talking about risk factors in nutrition, the kinds of things, because the topic here is reversing heart disease. I can show you what it is that we need to be doing to reverse these 4 conditions that generate the vast majority of the heart disease that we have in the United States. And number 1 is the obesity. All we have to do is follow the diet on the right. That's Dean Ornish, a whole food plant-based diet. Avoid the short-term weight effects of like the Atkins diet, the keto diet. It actually is a long-term weight solution because it increases in mortality and dead people tend to lose weight. But that, and I wish I was saying that jocularly, there's a lot of data to that effect. I'll show you just a little bit of it. But if anybody's interested in it because you're doing a keto diet, please, particularly because you're interested in reversing diabetes, please just Google the words keto diet mortality, and you'll see multiple articles come up. And it's all about the fact that when you do an Atkins diet, you're focusing away from carbohydrates, refined or unrefined, and you're focusing on fat and animal protein. And when you do that, you increase your inflammation and your bad cholesterol, your LDL cholesterol. You put those 2 things together and you're going to get heart attacks. And so whole food plant-based diet, more sustainable, better for the planet, better for people as well. We should talk about the fact that there's a massive amount of data for blood pressure as well, not just obesity, saying that if you change to a vegan diet, you're from an omnivore, meaning eating everything diet, you will have a significant drop in your blood pressure. Some studies were more than others. And, you wonder if it didn't work so well, what was the adherence to the new diet? How good was it? But the fact is the vast majority of the data indicates a drop in blood pressure. And we've got some good randomized trials, such as the DASH trial, saying lower the sodium, increase the vegetables, lower the animal products, and you will get a fall in blood pressure. How about cholesterol? You may have heard this, that cholesterol is all about your genes and it doesn't really matter what you eat. That is not true at all. It turns out that a dietary intervention, you want to reverse the high cholesterol, you go on a whole food plant-based diet, and you will see a significant drop in the cholesterol. We'll talk about mechanisms in a bit. One of the best ones that I try to show at every talk because it changed my life came out in March of 2003. So it's almost exactly 20 years ago that I read this article on the day after I had found out that at the American College of Cardiology meeting that my LDL cholesterol had skyrocketed when I reached 48 years old, and didn't understand it. We now understand that there are certain people, certain genetic proclivities that even on a relatively healthy diet, wasn't that healthy, but it was American Heart Association, no red meat, thinking in chicken and fish were actually healthy enough, never frying anything. No, it wasn't healthy because it had a deceased animal in it, and every animal has cholesterol. And so when I went on a whole food plant-based diet, like the portfolio diet, I had a dramatic drop, a little bit more than what you're seeing in this graph, more than a 35%. I had like a 50% decrease in LDL cholesterol. And I did check my C-reactive protein, that went away. For those of you not familiar with that one, LDL cholesterol is the so-called bad cholesterol that plugs up arteries. C-reactive protein is the marker of inflammation, and inflammation is what, once you have the LDL in a plaque, that makes it active and upset and turns it into a heart attack. So you can kill two birds with one stone and keep the person alive if you do a whole food plant-based diet. By the way, the black dots, that's a statin. And, we've got some good statins. Two of them are better than the rest. That's atorvastatin and rosuvastatin. And they do a similar kind of thing. And this is why there's a benefit, because they drop your LDL and they drop your inflammation. But so my practice, and I know there's a whole lot of cardiologists out there giving statins and not saying anything about diet. And we have a handful of plant-based doctors who were in the past, not so much anymore, saying don't take statins. Well, why'd they stop? Because we recognize with just case after case that the best outcome of someone who already has heart disease and wants to reverse it, the best outcome is when you do both together. And so whole food plant-based diet, exercise, and a statin actually work pretty well. Not everybody can tolerate a statin. You have to individualize that with your doctor. But in general, the population does very well with that combination. There was actually more proof, more recent, that the American Heart Association recommended diet from before the one that I was eating, back 20 years ago, was really not good for you because it doesn't lower inflammation, as opposed to a vegan diet that does make that cholesterol go down. I'm sorry, the cholesterol and the inflammation go down substantially, where you don't see a change with the American Heart Association. So what is all of that about? So I've described to you 4 different conditions and how a plant-based diet can actually make them better, reverse those diseases. Well, it turns out in the last 3 years or so, we actually figured out why. I mean, we used to think that, red meat was bad for you. There's too much sodium when you're eating a hamburger, and, the fiber is really good for you for a vegan diet. It's way more than that. It turns out that there's this one word, if you don't take anything from all this scientific presentation stuff, the one you might want to write down and look up is the microbiome. And so what is the microbiome? Well, it turns out that most of our body isn't actually human. That is, our cells are mostly made out of other things, microorganisms. And everybody's heard of viruses because of COVID, but there's also bacteria. There are funguses and one-celled animals all populating your body. Particularly, there's a microbiome in your ear canal, and there's one, between your teeth, and there's a microbiome, in your GI tract. The one we're talking about for cardiac risk is really in the GI tract. It determines when you're digesting food, how much are you going to absorb in it versus how much is going to go into the toilet. eliminate, someone was asking a question about toxins. Do you absorb the toxins or eliminate the toxins? It totally depends on what kind of bacteria you have in your GI tract. And so it turns out that there's a lot of neurological diseases that everyone's heard of: Alzheimer's, Parkinson's, multiple sclerosis. All of them are actually because of a leaky gut, of leaking the kinds of chemicals and immune mediators that attack the neurologic system. And so you hear these stories of, oh, my multiple sclerosis went away, I'm going to make a movie about it. And well, that's because you went on a whole food plant-based diet and changed the microbiome. So there are a lot of people have heard of the microbiome because somebody's told them to take probiotics. We don't have any really good randomized trials yet about it. We do have data on microbiome transplants. That is, if you are in the hospital with something, they give you antibiotics, you develop the dreaded Clostridium difficile, or C. diff for short, you could get a transplant of feces from your spouse and get that all cured because the bacteria actually can repopulate the right way. Well, repopulating the right way is something that you do with exercise. You could do it with bariatric surgery, but the best way is to change what you're eating. That is, if you're eating the carcass of a decaying animal, you're putting into your system bacteria, and sometimes they're large enough to make you sick, sure, E. coli, salmonella, those kinds of things that you've heard about. But most of the time, you're just changing how many bacteria and what kinds of bacteria are residing in your GI tract. And if you are eating a whole food plant-based diet, you put good ones in. And if you're eating an animal-based diet, you put bad ones in. It's as simple as that. And so the relationship between those four, I'll just show you very quickly. There's loads of data. Here's the data on high blood pressure. So it's very clearly that these particular bacteria shown here, you get a lot of them, your blood pressure goes up. Where does it come from? Eating animal products. What happens when you eat dietary fiber from a vegan diet or vegetarian diet? You get more of the chemicals that improve your immune function and lower your blood pressure. How about cholesterol? Turns out that the good kind of the good kind of bacteria in the GI tract can actually metabolize out your cholesterol and send it to a thing called caprostanol, which none of you have heard of. I hadn't heard of it until this research was published. That's because nobody cares about caprostanol. It's a sterol that goes out in the stool. And so instead of having cholesterol in your arteries, you'd have caprostanol in your stool if you have the right bacteria to digest, so to speak, or metabolize your cholesterol. How about type 2 diabetes, the focus of this organization? Well, it's a massive amount of data. It's hard to put it on a slide or two. And they have it down to the science of which bacteria, shown in blue, will decrease the likelihood of type 2 diabetes, and which ones, shown in red, will increase it. And they're wonderful review articles like this one, if you want to do a screen capture and read it. But it's going to boil down to stuff like this that may be a little bit, you look at this and say, hey, that's too much information, right? Actually, it isn't. It's just 4 little areas. One's inflammation. The second one is what's happening to your sugar and your insulin. The third one is what's happening to energy and breakdown of fats. And the fourth one is how leaky is your gut? Are you going to absorb a lot? Or is it, you're going to keep stuff in, absorb what you need, and the rest of it's going to go out? And it turns out that there are bacteria that promote good function of all 4 of those quadrants. And then there are bacteria that promote dysfunction of them. And so the science of this is increasing so much that we know that we should be making changes in the microbiome to get to reduce our diabetics. And I would think that that's, we've got so many new diabetes drugs, they're wonderful. They protect the heart, fantastic. How about getting rid of the diabetes in the first place by changing the microbiome? And you do that by changing the diet. Now, for obesity, that's a whole different story that's almost identical. That is, you can change how you break down carbohydrates and when you eat, depending on what kind of bacteria that you have. And the short chain fatty acids, that they can lower your blood pressure. How much of the food are you fermenting and absorbing versus excreting? All of it is determined by the microbiome. So you could do the fecal transplant and have someone lose weight because they got fecal transplant from a thin person, and you could actually do the reverse as well. And I know that sounds like a strange thing to do, but at some point, people will be taking poop pills or fecal enemas to try to change these particular 4 risk factors. Now, I'm going to talk a little bit about a chemical that if you haven't heard of it, you probably should. And I don't know that you could run out to your doctor and say, hey, I want my TMAO level, but it's not a bad idea. Unless you're vegan already, then you don't have to worry about it. But it turns out that there is a compound, 4-letter word, if I could use that term, trimethylamine N oxide, that actually correlates with eating animal products, and it affects the heart, the brain, kidneys, all blood vessels. And the really important thing is that it's related to diet, particularly red meat. Now, there are other reasons not to give white meat a pass as opposed to non-meat protein, which actually is really good. But in this case, this particular chemical can go down within 4 weeks, disappear if you just stop eating animal products, particularly red meat. And so you can see the on and off trials that were done, all centered around trying to get rid of the development of trimethylamine N oxide. Well, it does work. So you can go from a non-meat diet to white meat, you do okay. You go from white meat to red meat, you're in trouble. What does the TMAO do? Well, the data is actually very clear. This is another one of those Kaplan-Meier plots, but instead of survival, it's accumulation of bad stuff, heart attacks, strokes, dying, that kind of stuff. And it turns out if you've got a low level of this in your bloodstream, you actually do pretty well. But the higher the level is, the worse you do in terms of cardiac events. This is heart failure, where it showed that surviving with heart failure for 5 years is very much dependent on how much of this TMAO stuff you have. And so the highest level gives you the worst outcome. Why is it? Well, some of it is because there's actually a pathway of damage that happens when you're doing, when you have TMAO. But part of it is that TMAO goes up when you're doing the wrong thing. In this case, red meat. We've had data. This is, look at that. That's March 2012. So 21 years or 12 years ago, or 11 years ago, we've had this data for quite a while from Nurses Health, health professional follow-ups. And I know people criticize Walter Willett and Frank Hugh and say that, this data can't be real and meat is good for you. And you guys don't know how to do a study, and 30,000 people followed for 30 years doesn't mean anything because they don't know how to fill out a food frequency questionnaire. Well, they're doctors and nurses. They can do a pretty good job of recalling the kinds of things that they buy at the grocery store. It's not that hard. And it wasn't just cardiovascular disease, by the way, it's cancer mortality as well. The data is very clear. There's an increase. The more you eat, the more you die. And the biggest increase for those people who say anything in moderation, the biggest increase in that slope, that uptick in dying, is between 0 and 1 serving per day. So you're best off eating none. Save a cow, save a kidney, save a life. So anyway, the ischemic heart disease, again, is the heart attacks and getting stents and bypass surgery, uniquely associated with eating red meat, particularly processed red meat. For those who are not looking at that literature, processed red meat would mean like ham, hot dogs, sausages, bacon. And if you're doing those kinds of things, you're getting chemicals as well as red meat together. It's a bad combination, resulting in a lot of heart disease. It's true in every population that's ever been studied. This is the doctors and nurses again. And what was unique about this study is they try to tell people what they should do once they get rid of the red meat. And the answer is almost anything. This is the one study that showed that fish was worse than red meat. And I don't think even the authors believe that. But in this case, you're certainly better off with any vegetable-based protein. So whether it's coming from soy or nuts or beans or grains, that's really what people should be eating. I talked about heart attacks. How about heart failure, where people end up swelling and short of breath and fluid on the lungs and all of this stuff? This really happens because they're eating meat. And the people who are eating even a modest degree of processed red meat on a frequent basis end up with a significant increase in the development of heart failure and a 243% increase risk of dying of heart failure. So this is something that could be dramatically reduced. Heart failure is so expensive for everyone involved, the family, the patient, the institution taking care of them. Everybody's paying for this. So let's do better. Now, I should talk a little bit about what happens if you don't have that eating pattern, and in fact you do a plant-based eating pattern. It really is about a 41% decrease in the incidence of heart failure. And so, and what's causing it? It's very simple. It's having a plant-based diet or not having a plant-based diet. If you do a plant-based diet, you will see a dramatic improvement in the microbiome, and therefore reducing all of the cardiovascular risks that I've been talking about. It takes about 2 weeks to change the bacteria to the ones that are going to do you good from the ones that do you bad. Now, before leaving that topic, I'm just going to mention, for those of you who are skittish, and I know from the intro, not everybody here is a complete vegan, and when you really should be. So I'm going to show you the data. So take a look at that title. Is talking about egg consumption. People, and even a lot of the vegetarians were eating eggs in the past until they hopefully saw this data, that the more you eat of eggs, the more people die. And every half an egg increases the death rate even more. If you didn't believe the American data, well, here's the Italians. And they said anything more than 4 eggs a week, which is about a half an egg a day, increases mortality of all causes. But getting heart disease risk, all you needed was 2 to 4 eggs per week. And so please, it increases your risk factors, high blood pressure, high cholesterol, need to change the diet away from eggs. This was one that was published just less than a year ago, saying essentially the same thing, but they were going even finer. 50 grams of eggs is just a very small amount. People really shouldn't be eating eggs at all. But what I'm saying about that, there's good data that there are no safe animal products. And anytime you take an animal protein and you substitute it with vegetable protein, you will decrease the death rate. And so this is Nurses Health and Health Professional Follow-Up again. Any of them notice one risk factor. So, and many of us have at least one risk factor. And this is the data. I'm going to blow it up for you. What it shows is that there are no safe animal products, but some are safer than others. That is, fish and poultry are a hair safer than dairy, which is a hair safer than red meat, which is a lot safer than eggs, which is a whole lot safer than processed red meat. Okay, now people push back mostly from the Egg Board and the Cattlemen's Association. The dairy industry really pushed back hard against Harvard, saying that Harvard School of Public Health doesn't know what they're talking about. Well, I think that's highly unlikely. So interestingly enough, the Journal of American Medical Association published it again. That is the same title, but it's 3 years later, and it's not Doctors and Nurses United States, it's the Japanese Public Health Center, and the data looked almost superimposable, except in their study, the red meat and processed red meat killed people at a very much larger rate than the rest, but all animal products increased cardiovascular disease. Yes, it got published a third time. This was in 2020. And this was actually our United States National Institutes of Health. So if you don't believe Harvard, you don't believe the Japanese public health, how about our own National Institutes of Health that you're paying the taxes for? What do they say? They say that every animal product increases mortality when you change it to vegetable protein. The hazard ratio, that is how much death, so 0.9 would be a 10% decrease in death. That's what happens if you just get rid of some of the animal protein and substitute it with vegetable protein. It's true of red meat, a variety of diseases. It's true of eggs, a variety of diseases. Don't eat animal products. So anyway, a few months ago, there's another article really saying this exact same thing. Protein sources, the more processed meat, unprocessed meat, eggs, dairy, all of them increase mortality. So when you eat plant-based protein, that is inversely associated. It's a fancy way of saying that you die less. Okay, and so this is what it really looked like. Substituting plant protein for animal protein looks really good. And not just for cardiovascular disease, but dementia as well, which I think most of us fear almost more than a heart attack. The data on keto, I promised you that I would mention that. The definitive study was Sarah Seidelman taking 15,000 people, looking at their diet who were trying to do or trying not to do keto, doing it with plants, doing it with animals. It turns out that if you do keto with animals, you increase your death rate a lot, but you can do it with plants and it decreases your death rate. And that's because those plant-based keto, they're getting all their protein and fat from healthy sources, more unsaturated, not saturated, and plant-based protein instead of animal protein. So 18% decrease in death, as opposed to doing it with animals where you get an 18% increase in death. And so the more keto you get with animal products, the more mortality you get. Now, I got to take issue with some of the way science is interpreted. So hang with me for a little bit here. It's just a little technical, but not that much. Okay. How many of you have heard of a Mediterranean diet being good for you? Hear it over and over again. This is the U.S. News and World Report coming out and saying one more time in 2023, a few weeks ago, that the #1 diet was the Mediterranean diet. Well, they're basing it on this one study that was published 5 years ago. And they're looking at this upper left-hand corner. By now, you know what a Kaplan-Meier plot looks like. So you know this one going upward is just more events over time. You start off with none, and then you could gradually accumulate it. And there were 3 arms to this trial. One that had the usual diet, but they tried to lower the fat. And then they had 2 arms of the Mediterranean diet where all the red meat was substituted with fish or some poultry. And then they split the Mediterranean diet into 2 categories, one with extra virgin olive oil and the other one with nuts. And as you could see, extra virgin olive oil and nuts came out about the same. But compared with the control diet where you hadn't gotten rid of all the red meat, you ended up with a 30% decrease in heart attack, stroke, and death. Really impressive. And so everybody took this figure. You see it in so many people's dietary talks, do the Mediterranean diet. I want you to take a closer look at the data. Well, it should have been right in front of everyone's face because this so-called figure 1 had an A and a B. The B said that there was no significant difference. This little subtle difference with extra virgin olive oil wasn't statistically significant, meaning that you can't be sure it was real. And certainly the nuts and the control diet were the same. So what it's saying is people died the same. So what was this all about up here? Heart attack, stroke, and death. Well, it turns out it was all about stroke. Changing from red meat to fish decreased the stroke rate substantially. Okay, but heart attack, so-called myocardial infarction, was the same. Death from a cardiac issue was the same. Total death was the same. Now, so that meant, you eat the animal products, you switch from red meat to, instead of killing a cow, you're killing a chicken, okay, and then killing yourself. I mean, it didn't make any difference. Now, people will argue with me, particularly the neurologist, and say avoiding stroke is really important. And that does play into our guidelines about, fish, because there's a stroke benefit. But as a cardiologist, telling somebody, well, I'm glad you avoid a stroke, but they died anyway, that really doesn't excite me. Now, that same group published the truth, but it ended up being in an off journal. I mean, I don't know, insult to American Journal of Clinical Nutrition, but it's not Journal of American Medical Association in terms of so-called impact factor, how many people are reading it and quoting it. But this was the data shown from their study where they took all the 7,200 people and turn them around, okay? Turn them around based on how many vegetables they were eating. And it turns out that if you were in the highest group of vegetables versus the lowest, that is a pro-vegetarian pattern of Mediterranean diet, there was a 42% decrease in death. So vegetables save lives, okay? And animals kill pretty much everyone. Another one that came out a few weeks ago that everybody should see is healthy eating pattern and risk of dying. And it showed exactly what you'd expect. When you're eating plant-based diet, you do much better. Particularly what exciting was the African-American population, non-Hispanic Blacks, having the best outcomes if you were doing a healthy plant-based diet. So please, everyone of color, and well, really everyone, but particularly people of color. People of color have more cardiorenal disease, particularly in the United States. There are two different genes, ApoL1 and MHY9, that code for worsening kidney disease under the bad circumstances of high blood pressure and the like. And it turns out that it depends on protein intake. It turns out that animal protein increases the amount of risk dramatically. And so what do we need to do? Change to a vegan diet. The data is very clear. Plant-based protein lowers the risk of kidney disease. Red meat puts you on dialysis if you had kidney disease, but that progressive worsening of kidney disease does not have to happen if you just change them to a plant-based diet. Why? That's the TMAO. Again, it's not just heart attack, stroke, and death and heart failure, it's kidney disease as well. So again, poor long-term survival if you have a high TMAO, which comes from red meat. Save a cow, save a kidney. Okay, so if you have chronic kidney disease and you're not on dialysis yet, what do you need to do? Change to a plant-based diet. It lowers the risk and the complications, and you end up with so many benefits. You don't get the development of heart disease that all the kidney disease patients get. Soy protein is a particularly good one for a protein diet that will protect the kidneys. And it's not just the kidneys, it's the heart, it's the blood pressure. Everything is better if people are doing soy protein when they have chronic kidney disease. So here you go. This is a public service PDF from that's Vegans Incorporated. No, this isn't vegan propaganda. This is National Kidney Foundation asking all the doctors to please put your kidney disease patients on plants because the data is very clear. But I don't see people who in the nephrology world picking up on this. I don't see them dietitians changing people. In fact, they argue with me saying that they're protein catabolic, they need more meat. So if your goal is to make money off of dialysis until they're gone, because dead people don't come to dialysis, then go ahead. But this is not what the data shows. Okay, so I talked about the microbiome earlier, and I would be remiss in not mentioning the relationship to COVID illness. We should have had the guts to go vegan, a bit of a pun, because it would have been great if all the world leaders said, hey, plant-based nutrition, these people don't seem to be getting sick. Now, the why? It's because of the immune response being so much better in people who do a plant-based diet because of the microbiome. You don't end up with cytokine storm and inflammatory markers if you've got the good bacteria in your GI tract. So don't eat decaying flesh. You don't get those bacteria in your GI tract, you're going to do better. So this data, I wish it had come out a year earlier, but it was October of 2021. And it was very clear. People eating plants don't get sick from COVID very often. 73% decrease in moderate to severe illness. And I still have not heard of a vegan dying of COVID. And I've said that so many times, nobody's heard of a vegan dying of COVID. And so it would be nice if everybody, as long as we still have this illness or any kind of viral illness, remember that your immune system is stronger if you're doing plants and you don't end up with all the risk factors. So you get rid of the hypertension, diabetes, obesity, high cholesterol, and COVID illness, not COVID. Loads of vegans I know got COVID, including me, but you didn't get very sick. And so we had the answer to COVID and hypertension and high cholesterol. We had it and we published it in 2019, just in time. Unfortunately, it was largely ignored like everything else I've authored. And so we were telling people how it is that you could avoid cardiovascular disease. And a big part of that was nutrition. More vegetables, fruits, nuts, beans, whole grains. How did fish swim into the guidelines that I actually authored but got beat down about? It's because of that stroke benefit. And when you do stuff with the American Heart Association, they are a stroke organization. So I have to give them a pass on that. But, you know, for the heart, fish is not good, only for stroke. But getting rid of saturated fat, cutting the cholesterol, cutting the sodium, processed meat, refined carbohydrates, sweetened beverages, remove all those, and you're going to do much better from a cardiovascular point of view. You could take those guidelines and do medically tailored meals, and this was published about 5 months ago. Dramatic costs of healthcare, dramatic reduction. What can we do with that money? Roads, bridges, you know, more defense spending because China's sending balloons. I don't know what you want to do with this money. Yeah, send every kid of a family that's in poverty level to college for free. Why would we spend it on healthcare? You know, wasting it on the poor choices that we make as a society. So you just saw Baxter Montgomery. I'll mention him in a second. This is actually Loma Linda, showing that if you look in African Americans, you will see a dramatic improvement in all those risk factors if you just do the vegetarian diet. If you look at Baxter's data, too bad he left and you get to see a plug for his work. He looked at all of the things that you're seeing in blue, those risk factors. Then he did another study showing them in black. All of those parameters of cardiac risk dramatically were reduced by changing a diet. Now, he did 4 weeks, and it was great. I did a similar study on the south side of Chicago in a church for Lent. It was Obama's old church, and we published it to get the word out there. If you take a high-risk population and you change the diet, everything improves. So, yeah, there's too many words maybe to look at it, except the bottom line, 19% out of the 21% increase that we have was eliminated. And this is what it looks like graphically. Insulin level, and remember that TMAO we were talking about, 43% decrease in both of those. But every cholesterol, every blood sugar, every parameter of risk, every one of them got better when you did a plant-based diet. It actually was, people adhered to it pretty well. There was a loss of 440 pounds out of these 44 people who came back for their second study. And we were able to reduce their 10-year risk dramatically. This is in a cookbook, by the way, that follows the ACC/AHA 2019 primary prevention guidelines. It's called the Heart and Soul Cookbook. And you can just put that in Google and see the abcardio.org is under the patient information. So I have to give a shout out to Sarah Hull, who is at Yale, who came out and very strongly a few weeks ago or a couple of weeks ago said that we are what we eat, and it's morally not right for medical professionals to not promote a plant-based diet. I agree with her completely. But how many of my colleagues are actually following the guidelines that I wrote? I was very disappointed. This is the data from a survey that we did before I left Rush, partnering with Loyola. Pesco vegetarian, eating fish and otherwise vegetarian, and then completely plant-based, 11 out of 274. That's really abysmal. And we don't help with our hospital food, and we don't help in medical meetings. This is from the American Society of Preventive Cardiology. I took a picture. I was so appalled. And this was after I gave my talk. I was just, but you know, you've got implementing change and behavioral impact are very difficult. It's much easier to talk about the science than it is to actually get people to change. So I was asked to talk about reversing heart disease. I've shown you reversal of pretty much all of the risk factors, but there's data on coronary disease as well, because it's not coronary disease, it's culinary disease. What you see is a dramatic, if people go plant-based, reduction in the incidence of heart disease and the death rate, and 24% lower risk of mortality, that is dying from coronary heart disease if you're a vegetarian. And it's better to start now, start at a younger age, so you can lower the lifelong cholesterol. And so there is data showing with Caldwell Esselstyn's plant-based diet that coronary disease can go away. And there's data with Dean Ornish showing the same thing. The most adherent group gets the best result. And this is more Ornish data. You know, not too many nuclear cardiologists in the audience. This blue patch is really bad blood flow, not quite zero, but low. And when the patient came back after a plant-based diet for just 3 months, you ended up with much better, it's not perfectly normal, but much more improved blood flow in that one artery. So you can see it by anatomy, you can see it by flow. So in closing, I just want to summarize that, you know, we have a lot of data on heart disease, kidney disease, stroke, the ethnic disparities that happen. They're all over the world. We need to promote plant-based diet to reduce these diseases that are so unnecessary and are mediated by the microbiome. Particularly during this dual pandemic, it's time to really check into what we're eating and make a difference, make a change and make a difference. Actually, I do have one more slide. I'm done with the talk, but can we start with the reverse question and answer? Is that okay?
Sure.
Okay. So the question is, for the audience, what's the death rate from eating beef? Anybody?
100%.
Aha, you've seen it.
Oh, I haven't actually.
Oh, really?
It was a wild guess.
You were absolutely right.
Wow.
And so save a cow, save a kidney, save a lot of stuff, save our planet. You know, people talk about buying electric cars. I got an electric car. Great. You know what? I'm doing way more with my diet for the planet than I am with my electric car. Okay. Fact of the matter is that beef is way worse than the planet, for the planet, than car emissions. And that's because just the basic chemistry of methane versus carbon dioxide, 23 times more potent when it comes to warming up the planet. So please, we've seen people in New York, you're seeing it in Illinois. People need to start legislating schools, hospitals, everywhere to have more plant-based options. If we do that, we're going to be better off. All right, thank you. I'm going to stop sharing and try to answer the questions and check on my little situation. I know I ran exactly 63 minutes, but okay.
Thank you. Thank you so much, Dr. Kim, for such a wonderful scientific presentation. I call it, this is an information overflow, information overload. You have given us a lot. But, you know, to start with, I would just like you to know that this organization will get back to you later. I know your time is so short, you don't have time, but we appreciate your presence and the powerful presentation you have given us this evening. Thank you so much. May I know, Dr. Kim, if you have time for maybe 3 or 4 questions?
So I'm actually checking right now. It's trying to get my, it turns out that I have, it looks like I could do it, but if I look distracted, don't worry. I answer questions with a different part of my brain. So go ahead.
Yeah, Marti, please go ahead.
Okay, so Dr. Williams, a question has come up in the panel in that, you know, we've got these alternative meats.
Yes.
2 things. One is the fact that if you go vegan, of course, the question is always, where can I, as I'm transitioning, where do I get my protein? I know you answered that question, but that's still on people's minds and
Yes.
in terms of will I lack in that area? But the second part is, if I do these alternative meats, people are saying that that's not good for me. What is it about the alternative meats? What's in it that actually is not beneficial to our bodies just to mimic the meat?
So the majority of them actually are healthy in terms of number of brands. In terms of prominence of brands, no. Beyond Meat is better than it used to be in terms of saturated fat and sodium. That's the issue, okay? And it turns out that the Impossible Burger has just as much saturated fat as a Burger King Whopper or a McDonald's, a Big Mac. And so we've got to get everyone to take your package when you're going to eat a veggie burger or a meat substitute, flip it over, look for saturated fat. If it's less than 3 grams, you're probably going to be okay. And the sodium, if it's there's no limit on a given serving, but the limit for particularly African Americans, hypertension prone, would be 1,500 milligrams a day. So if something has 1,100 milligrams, it's like, well, you're going to eat the rest of the day. But if it's got 600, that's a lot. You eat that 3 times, you're above the 1,500. If it's got 300 milligrams, you're probably going to be fine. And so please take a look at the meats. Our FDA has mandated that all of these prepackaged things have labels on them, and those labels are extremely helpful.
Okay. And the other thing is that we've talked a lot about diet, about eating plant-based. Where does the exercise fit into that? And one person did ask a question, how much exercise do you recommend for optimal heart health? Or, can you address that a little bit?
Oh, absolutely. So it turns out that our recommendation was 150 minutes of exercise for prevention and 300 minutes a week for treatment. Now, based on literature that was published about 2 weeks ago, we have to revise that a little bit. And it goes in the theme of reversing heart disease. It turns out that high intensity exercise does a better job of plaque regression. And so when you're going out for a walk and you see a light pole, sprint from light pole to the next light pole, and then calm it down, back it down, high intensity interval training, or just play tennis. Okay. Pickleball won't do it. It's not enough mobility involved. But high intensity, if you get out of breath, you get to aerobic threshold, then, congratulations, then you go play the next, walk to the other side and play the next point. So it just turns out that tennis is one of those things. And so we're learning more and more about that sport and why there was a 17-year life expectancy improvement in tennis players. I always thought it was, used to play professional tennis, still play tennis. I thought it was bogus. I thought the tennis players were more strategic thinkers, more educated, more money, and so better healthcare access. And all of those things are probably true. It's just that it may actually be the tennis after all this.
Well, thank you.
Okay.
Let me ask you this one, Tamik, if you have a question from an audience, please jump in. I just want to find out is one of the things that I know you're out there doing in terms of policy is trying to affect change with the government, with the school systems, et cetera, hospital systems. The challenges that you're experiencing and the roadblocks that you're experiencing being out there, what can we do as individuals to work to affect change, within our own families, within our own communities? Do you have any thoughts on that?
We really needed to start with, first of all, screening. And that's what I'm doing in Louisville, screening and education. That is, so many people have so many risk factors and they don't know about it. And so we set up the HEART program, helping everyone address risk today, where we do a finger stick cholesterol in a church or a community group, or last weekend we did it in Joe's Palm Room. It's a restaurant on the west end of Louisville. And people come. The people who come to a free screening, I find after 12 years of doing them, they tend to be people who know they had something wrong and they didn't follow up. They come for a free screening. Great. Okay. Then the next issue is once you find out that their risk is elevated, by the way, how do we do that risk? Blood pressure and a finger stick cholesterol, okay, and a blood sugar. And everyone should have the so-called ACC risk calculator. Please just write it down, ACC risk, and your app will show up, and you take it to your next, your Easter dinner. Oh, Uncle Joe, haven't seen you in a while. How old are you now? 79, male, African-American. What was your last blood pressure? And you put all the stuff in, and it'll tell you what the 10-year risk of having heart attack, stroke, or death is. And you can use that information to determine whether or not they should go for further screening or anything else. But once you know what your risks are, then you can actually do something about it. If you don't know your numbers, you're not going to do anything about it.
Thank you so much, Dr. Kim. We will let you go now, but thank you once again. And I'm going to ask my audience or our audience to show appreciation with their electronic hand, with a thumb up, or with love. Waiting to
Fantastic.
see those flying up. Great. Thank you so much, Dr. Kim. You see that yourself. Thank you for your time. We will get back to you again. Marti, what do we have tomorrow?
Tomorrow, we're going to talk, we've got Dr. Neil Barnard, who's going to actually talk to us about reversing diabetes. And then we have Dr. Daniel Ganu, who's our co-host right now, who's actually going to talk about the launch of the Lifestyle Center that's actually going to launch in Ghana. And so he's actually going to take us through how he got to the point where he had this vision of doing that and what his vision is to get this thing going. And so why he miraculously got healed by rheumatoid arthritis and what caused him to want to start the center. I want you all to come back tomorrow to be there so we can actually talk about not only the Lifestyle Center, but also reversing diabetes, which I know impacts many, many people around the world. So again, thank you. And we look forward to tomorrow.
Thank you so much. Dr. Kim, thank you. Thank you so
Absolutely.
much. We will get back to you. And thank you, everybody, for the time. It is a time worth spent together. I believe you have really, enjoyed this presentation and you have gained a lot of knowledge. I did myself. Thank you so much.